Hello, everyone. It is my pleasure to introduce our keynote speaker. Dr. Victoria Dooley, MD, is a board-certified family medicine physician and healthcare activist. Dr. Dooley's dynamic personality and commanding stage presence make her sought after as an on-air health expert on numerous live radio and TV broadcasts. For over 2 years, she was a weekly contributing medical expert on Detroit's ABC WXYZ TV News. She also displays her passion for health education in print and has published op-eds in the New York Times and HuffPost. Dr. Dooley is beyond frustrated by the financial challenges of navigating today's system of for-profit healthcare, and she is committed to making Medicare for all a reality because healthcare is a human right. So I will turn it over to Dr. Dooley.
Dr. Dooley, I believe you're muted.
Okay, now can everybody hear me?
Yes, loud and clear.
Okay, excellent. So thank you for that introduction. And I just want to thank you for having me as your speaker today. I'll tell you, it's been a rough, 13, 14 months. And this weekend, I had two things to look forward to. First of all, connecting with you students and talking with you this afternoon. And after I'm doing that, I'm joining Senator Nina Turner, who is running for Congress. So I'm actually in Ohio, even though I'm from Michigan. So after having a very long year, pandemic year, this has been a very exciting weekend for me. So I want to thank you for having me, and I'm very excited to talk with you today. So a lot of you may not know that I went to medical school in Detroit, Michigan. So I saw a lot down there. Detroit being a really urban city where a lot of people were underinsured, just like most Americans, and uninsured. And then I completed my family medicine training in Flint, Michigan. And so when I'm completing my family medicine training in Flint, Michigan, most of you should be aware of that city and the Flint water crisis. A lot of people are on Medicaid or underinsured or uninsured since all of the big auto makers left the city. You don't have those good factory jobs anymore. And I'll tell you, most of the medicines that I prescribed were on the $4 Walmart medication list, because again, I'm dealing with a population of people who don't have that good insurance and who can't afford medications or don't have any insurance. And sometimes those $4 medications were adequate, but too often they were not. So now I'm practicing in a more suburban area. I have a little bit more flexibility, a little bit more medications I prescribe, but we should not live in a society based off of how I prescribe medications for you is based off of financial reasons. I go to the office every day. I am a full-time physician. And the most common question I get asked is, how much is this going to cost? And that's so frustrating for me as a physician. Of course, people ask me about side effects and other questions about health, but almost all patients, when I say you need this test or this medication or this exam or this referral to this specialist, their first response is almost, how much is this going to cost? And in my opinion, that's just a question that should never come up in a doctor's office. And when you think about the fight for healthcare in this country, specifically being a Black female, and how it dates back to slavery days, where Black people, African Americans, were enslaved, and then finally we were freed. I put that in parentheses, but we didn't have healthcare systems, and we didn't have hospitals. Hospitals were segregated. And then you think about Medicare for all that, Medicare that we have now, which is not Medicare for all, but it's better than nothing. And I think that too many people, young people, don't realize the fight that doctors and dentists, the fight that we had just to get current Medicare, and how Medicare desegregated hospitals, especially in the South, where the government said, hey, if you want these Medicare dollars, you have to desegregate your hospitals, and just all of the pushback from groups like the AMA, right? This is a medical society. And there was pushback to, number one, providing Medicare to people who are 65 and over, and number two, to desegregating these hospitals, and all these hospitals in the South that didn't want to do it. So I think that we have to remind, especially some of the younger people, that no, it's not going to be easy to have healthcare for all, but it's very doable. It's very possible. When you think about how we introduced Medicare, we had this system that insured millions of people overnight, and we didn't have the technology then that we do now. So it's not an impossible task, right? Every other developed nation in the world has it. And when I talk to people of color, Black people specifically, I get a lot of concerns about, how is Medicare for all going to change my life? And I get it. Being Black in America, we get the short end of the stick in everything, just day-to-day life. And when you look at today and the police and all the shooting and killing of Black people, I understand how you think about one policy and seriously, how is that going to improve my life? But Medicare for all is part of our reparations. And when people say, what is reparations? Is it cash? Is it, it's about restoring, it's about repairing. So part of repairing what happened to us as a people is ensuring that we all have healthcare as a human right from the time that we're born. That's the way it should be. And they've kept healthcare from us for so long. Since we were freed slaves, they tried to deny us healthcare. So it really is part of our reparations. And then I've had some people say, well, you look at the Black maternal mortality rate, having an education and having insurance doesn't always mean that you're still going to survive as a Black mother. And I get it, it does. But studies do clearly show that your odds are better. They're not as good as white women or as good as other countries where they do have developed healthcare systems where everybody has healthcare as a human right. But your odds of surviving as a Black mother through childbirth are better when you have some form of health insurance. So when people say to me things like, well, all Medicare for all is going to do is instead of dying in the streets, Black people are going to die in the hospital. I get that frustration. I get that sentiment, but that's kind of like saying, hey, we should have never freed the slaves because instead of dying in the cotton field, we're just going to die in the jail. Well, yes, we do need to address racial justice and criminal justice reform, but I could not sit here a free-ish Black woman if we wouldn't have freed the slaves. So we can't have this all or none mentality when it comes to things that improve the lives of everyone, but especially people who are hardest hit in this country. Because when you look at every effort that's been made in this country to ensure more people, whether it be Medicare, the Affordable Care Act or Obamacare, or even expanding Medicaid, with every effort that we've tried to ensure more people, there is always a disproportionate amount of poor people of all colors and Black and brown people who are still to this day left uninsured. And this is not a complicated problem, right? So you have this wealthy nation, and the problem is there are too many people in this wealthy nation that don't have insurance at all or that are underinsured. They have insurance, but they can't afford their bills. So if I pose this conundrum to an 8-year-old, hey, we have a wealthy country, but there's some people who don't have health care. How would you propose that we solve the solution? That child's probably going to say, well, just give health insurance to everyone. That's a solution. That solves the problem. It is literally that simple. And if we don't know how to do it, we can look to our neighbors to the north in Canada. We can look to any other developed nation in the world and help model our plan after theirs. But I believe that we can do something better because we are a wealthier nation. We can make sure that nobody has to pull out their wallet when they go to the doctor's office. We can make sure that everyone has vision coverage. We can make sure that everyone has dental coverage. Me as a doctor, as a young doctor, I opened my own practice. I didn't have dental insurance. I delayed getting a root canal because I didn't have the $1,200 to get it done. And that's unacceptable. And it's not right. So as we unite to fight, we have to remind people that it is possible. It is something that they do everywhere else. And when you look at something like this pandemic and how we got free vaccines, which I'm super excited about, and I'm not trying to minimize that. But if any of you follow me on social media, I'm probably not the type of person who's going to praise an administration or a politician for doing the absolute bare minimum. I'm just not. So yes, it's a good thing that we can get COVID vaccines for free, but there's still numerous problems with that because some people are still getting bills for the administration costs of the vaccine, and then you have to fight to not have to pay for that bill. And I'm not willing to accept that we can provide COVID vaccines for everyone for free, but we can't provide any other vaccine or any other health service for Americans free at the point of care. I'm just not willing to accept that. So although this pandemic didn't bring about enough change that I would like to see, because when I think about what more could it possibly take, what more than a global pandemic for our politicians to wake up and listen to the majority of voters who support Medicare for all it really is scary. I don't want to imagine what more it would take than the pandemic that we've recently been in order to convince our politicians that we need Medicare for all. But we're making some baby steps. And when I think about my sons now, who are getting free lunch, and how it's just announced that children for the 2021-2022 school year, the government is going to expand free lunch. And I think about just a year ago, well, maybe a year and a half ago, like immediately before the pandemic, with people like Bernie Sanders and Ilhan Omar put forth this bill to make lunch free for all kids, and how I was excited about that. And I tweeted about that. And I had adult grown men who would attack me because I'm supporting all kids getting free lunch at school that is mandatory, that adults force them to go to. We're forcing little children to go to a place all day long, and we're not guaranteeing that they have something to eat. I mean, that's abhorrent. And for them to say, oh, well, you know what? Rich kids shouldn't get free lunch. Curiously, I haven't had anybody pop up in my Twitter feed saying rich people shouldn't get the COVID vaccine for free. It's just nonsense. So I think it's very exciting that we are having some changes, and we are realizing as a nation that we can do better, that we can provide meals for all children at school. And I believe you were just talking about before I came on, that how everything is so interconnected. Of course, you have to have housing to be healthy. So we have to work on housing the homeless. When you think about this system of education in the United States, where we have to physically take on, too many of us, hundreds of thousands of dollars of student loan debt just to achieve our dream of being a doctor. And you guys all know, right, that it is not easy. It's not something that, it's fun to do. Nobody says, you know what, I just want to go to school and for training for 12, 20 years after high school. It's not an easy feat. And then to graduate and be straddled with hundreds of thousands of dollars of student loan debt. We have to cancel all student loan debt, all of it. And so I'm just really excited about young people like you. Specifically, I think younger people are getting something that older people and even people my middle age aren't getting, is that we need to do better. And that as physicians, we need to focus on the social determinants of health, and not just what new medicine or new test or new surgery is out there. But we have to treat people as a whole, in a holistic way. And so I'm just really excited to be partnering with students like you who are excited about doing that, and excited about acknowledging that healthcare is a human right for all. And I would encourage you, when you talk to people about Medicare for all, this is something that I did when I was a surrogate for Bernie Sanders. I wouldn't just tell people, hey, I'm a surrogate for Bernie Sanders, let me tell you about some of those policies. With a topic like Medicare for all, I mean, everybody is underinsured in this nation. Everybody. Nobody likes whipping out their wallet when they go to the doctor or when they go to the hospital. Nobody likes surprise bills. So you could just approach them like, hey, wouldn't it be great if you could just go to the doctor and not have to whip out your wallet at all? I mean, who's going to argue with that? Very few people are going to argue with that. So we need to have these conversations where we talk about, wouldn't it be nice if? And then we can bring up how that's exactly how it's done in Canada, or that's exactly how it's done in Australia, or whatever. And encourage people, not just people who are like-minded like us, not like people who might be just the red and the blue and the Democrat and the Republic or whatever, the socialists or whatever, but just people in general, just to have conversations with them from a non-judgmental standpoint, and from I'm trying to force my liberalism or my whatever socialism on you, but I'm just speaking from my heart and about what's right for humanity. So I think we need to have more conversations with people who aren't like ourselves. We have to be willing to be activists and speak up with our patients to express, I do think it's nonsense that you can't get the best medication because your insurance doesn't cover it, and encourage them to look into candidates, and encourage loved ones and people, to run, who support Medicare, to run, and to not only run, but we have to hold politicians accountable once we have elected them into office. If they have ran on a single payer platform, we have to let them know that we are going to be marching and making calls and holding you accountable to enacting what we voted you in on, or we're going to vote you out. So that's how I think that we can unite to fight to get Medicare for all as a reality. And if it takes lowering the age incrementally to get there, I guess that's better than nothing. But I will be continuing to fight and to partner with organizations like you until their age is lowered to 0. And I hope that I will see that in my lifetime. And I believe with good students and people like you on my side that we will. I'm going to end there and see if there's any questions.
Thank you, Dr. Dooley. So we'll take questions now. You guys can use the Q&A function in your Zoom box at the bottom. And we can all give a round of applause for Dr. Dooley because that was an amazing speech. I think she truly represented what Unite to Fight means, talking about all these different programs and like solidarity between different issues. So far, not seeing anything come in.
Welcome.
Okay, we have a question. Dr. Dooley, what do you see as the legislative path forward for Medicare for All?
I honestly believe it's going to be lowering the age of Medicare slowly. I wish it wasn't so. I wish we could get big money out of politics and I wish we could, as a nation, elect enough politicians to say, hey, we have a plan over 4 years to lower the age to 0. But realistically, I don't think that's going to be possible. So I think that with this administration at this point in time is going to have to take gradually lowering the age of Medicare.
Okay, and next question, how did you get started in the Medicare for All movement, Dr. Dooley?
Well, the Medicare for All movement, I think it was just the process of what radicalized me, my patients. Again, I trained in Flint, where a lot of people didn't have enough insurance or any insurance at all. And then I trained in a suburban city, and it wasn't perfect, but it was a little bit better. And I'm like, hey, these cities are only like an hour and 15 minutes away from each other. How come in one city, I'm basically restricted to this $4 list of medications that I can prescribe, and then I drive, 60 minutes in another direction, and people have better jobs and better insurance, and it's just not fair. I mean, when I was a kid, my dad had one of those Cadillac insurance plans that aren't really around anymore. And I remember I had bad acne, and I remember going to the pharmacy, picking up my acne prescription. It was like free. I was like, okay, that was normal for me. Then I got a little bit older, and it was 50 cents. And I'm like, okay, that's annoying, 50 cents, but okay, I'll take my 2 quarters to the pharmacy. And then I went to college, and it's like I had no insurance. And so just hearing my patients and the plights that they go through, parents whose children have cancers, and the oncologist is recommending one form of treatment or chemotherapy, and the insurance just flat out refusing it. I've seen patients die because they were older and they had no health insurance. So they were literally waiting until they turned 65 to go to the doctor when they turned 65 and got Medicare to go to the doctor. And then by the time they turned 65 and they came to the doctor, we found out why they were losing weight, why they lost 20 pounds in the past couple of years was because they had a cancer. And at that point it was end stage. So what radicalized me and got me in this movement specifically is listening to my patients, because I care and I'm passionate about them. And then with the Senator Sanders campaign specifically, is I was fortunate enough to meet Senator Nina Turner, who brought me into the campaign.
Okay, yeah, thank you for that. Next question is, what advice do you have for medical students interested in getting involved with direct legislative advocacy?
Getting involved with what, I'm sorry?
Direct legislative advocacy.
Okay, well, I think as your students, you're connected with Physicians for a National Health Program, and they're very useful. There's a ton of useful information on their websites. We can create petitions. My malpractice insurance, I actually switched my malpractice insurance to a different company who is involved in activism now as a private physician. So I read up about the company and saw some of the things that they're trying to do. They're mostly on the West Coast and like California and things. But I wanted to support them, a group of physicians who were advocating for physicians and healthcare providers, and not only for physicians, but for patients. So I decided that if I'm going to have to give my money to anyone for malpractice insurance, I'm going to give my money to organizations like that.
Another good question. How do you approach fellow healthcare providers on Medicare for All, and how can we as students go about diplomatically approaching attendings and residents and things like that with discussing Medicare for All and our activism?
That's an excellent question. And one of the things that's frustrating for me is I don't know enough doctors who are as vocal as I am on this issue, besides the doctors with SNaHP and PNHP. And it's tough because, right, when you think about this for-profit system, what's happening? These huge healthcare huge hospitals are buying up private practices, and private practices are like a dying field. So if you're employed by somebody who obviously does not want a single payer system because they're going to lose those private payers who pay them more, I can understand why it'd be scary and frustrating to speak out on these things. So I think the key is to not use terms like non-compliant, because no, I'm not compliant with my insulin. I can't afford my insulin. So, when you're talking to an attending about a patient who's admitted with DKA, find out why they're admitted for DKA, and not say it's because they're non-compliant. The patient is here in DKA. The patient has not been using their insulin because it costs $500. Then you start talking about how this hospital at admission is going to cost way more than the insulin would have cost to keep them out of the hospital. So if you talk about how it would save money to do the right thing, then I think it comes off as you're not trying to be confrontational, and you're very factual. It actually will cost us less money to care, to give a darn, right? To make sure that all people can get their medications and not end up in the hospital. It actually is going to save the health system a lot of money. So when you are taking your histories, avoid words that put blame on the patient for conditions that are out of their control.
Thank you. Another good one. How did you balance being a clinician with your advocacy work?
Well, I was fortunate that I do have lots of help, as I'm a mother as well. I have two teen boys. So I have a lot of family support and help. And this may come as a surprise to some of you, but I'm not one of the richest doctors in the world. And that's okay with me because I went into this field for a work-life balance. I'm a family medicine physician for a work-life balance. And to me, happiness amounts more to just dollars and cents. So I love my patients. They're like family to me. Me and my staff members, we love our patients. They're like family to us. And it is tough because I don't have a partner for when I wasn't in the office who could cover me. But I'm always available. I don't ever say, I'm gone to, do this, that, or the other. Champion for Medicare for All. Don't call me. I always make myself available for my patients. Another thing that the pandemic brought about, which was huge, is telemedicine coverage. I mean, it should not have taken a global pandemic for insurance companies to acknowledge that sometimes it's not the best thing for the patient or the doctor to physically see each other in the office. So now when I'm on the road, I can still see patients virtually and get billed and reimbursed for that. My patients know that I'm a huge Medicare for All advocate. And so the vast majority of them are very understandable when I take time away from my office to do that.
All right. And so I think that, as we know, when we talk about Medicare for All, it can be very hard with opposing viewpoints, dealing with bad actors and people who are not staying factual. So how do you prepare for your media appearances and combat pundits that are bad actors in our fight for Medicare for All?
I don't have one method that I do to prepare, but it's just life prepares me. Just being a doctor, going and listening to my patients every day prepares me. It prepares me with a ton of anecdotes, and you can't teach people compassion, but I mean, it doesn't cost anything to call them out on their BS, right? There's studies after study that show that Medicare for All saves money, that it's the right thing to do, and if it wasn't something that was doable, why aren't all these other countries abandoning it and taking on our model? So I think what prepares me is life and passion. And like I said, the fight that I have for my patients. I have decent health insurance, and I say decent because I can go anywhere I want, But if I go certain places, it's going to be a higher tier and it's going to cost me more. Unfortunately, I'm in a position where I could afford whichever tier of care I go to. So not everybody has that pleasure and that luxury. So my patients educate me, and my passion puts the fire in me. And I'm just somebody who's not scared to call you out on your BS. And another thing that I'm very a little bit different than some providers is I opened my office from scratch. I was the biller. So I learned how to do everything. I learned how to be a receptionist. I learned how to be a biller. I learned how to be a medical assistant, and learning how to medical bill is something that I took an interest in when I was finishing my last couple of years of residency. I would just go sit with the biller if I had some free time and ask them questions and pick their brains. So I know the business part of medicine too. So it's hard for people to fool me in any aspect of medical practice because, like I said, I'm a part of a dying field, which is a private practice who started things from scratch. So I can call them out on their nonsense.
Right, and then we'll take one more question. So I think it can be difficult for all of us with the change in administration. A lot of people think, like the battle was won because Trump is out of office. So how do we keep people motivated? How do we keep ourselves motivated when it feels like there's kind of that changing wind and people are not as fired up to fight for these things?
Right. Well, I will say personally that if you're ever in clinic with patients or you ever want to come by my office, you will clearly see that things didn't magically get any better when Trump lost and Biden was the same. I mean, people are still having to pay $250 for asthma inhalers. There are people who are still rationing insulin. So at least in my circle, the vast majority of people that I know aren't like, oh my God, thank God, life is good. We went back to status quo and everything is perfect. So again, just talking to people about, hey, wouldn't it be great if people could go to public college for free, just like they can go to public high school? Hey, wouldn't it be great if, just like Canadians, we could go to the doctor and not have to whip out our wallets? So to just keep speaking on the things that better is possible, to keep speaking on them in a like I said, in a non-confrontational way, and in a way that you're not trying to say, hey, you need to be super liberal or whatever. Just human compassion. Wouldn't it be nice if you did not have to pay tens of thousands of dollars for your kids to go to a public university? It's a public university. You don't pay to go to the public library. So just bringing up things that are common sense and reminding people in a nice way that not that much has changed as far as our medication prices, as far as hospital bills. Not a ton has changed. And that's what's so unifying about the fight for Medicare for all, because everybody eventually is going to need some form of healthcare. And if you don't, one of your loved ones, your parents, your siblings, it's going to be something that everybody is going to need at some time. So I think it's a great way to start conversations and encourage people to rally and unify around this topic.
Well, thank you so much, Dr. Dooley, for being here. I'll turn it back over to Rachel to conclude our panel. We really appreciated your speech and your question and answer session.
Thank you so much.
Yes, I will just echo Natasha's comments. Thank you, Dr. Dooley and Dr. Rogers, for speaking to us today. I know myself, I am just even more inspired to continue the fight for Medicare for all, and especially just to unite with a huge, broad coalition to make sure that we fight not only for Medicare for all, but for just broader social and health justice. So thank you again for joining us today. It was really amazing to hear from both of you.